At a loss to help someone you love with breast cancer? Then you've landed in the right place. She's terrified that she might die, whether she's saying it out loud or not. Her fears thundering inside her head in the middle of the night. And you're terrified too. Likely you're not admitting it either. But you're trying to be strong for her, and you're just hoping you'll also be able to say the right things, because you don't really know what you should say or what you should do. You're feeling helpless, because this time you can't find a way to make it all better again. But there is something you can do, something very practical that will make a difference right now. And the words right now are key in all of this, because saving time and energy, especially hers, is critical to her body's ability to withstand what lies ahead. So although you're reeling from all this too, you have to figure out what to do next. Sure, you'd love it if you could just snap your fingers and have all the top breast cancer experts in the world sitting around your table so you could grill them, so she could make the best possible choices for herself. But how? That would rack up too much time you don't have, and likely considerable travel expense to consult with the best of the best in each specialty. And then, of course, add in the fees to see these doctors individually. Yet you know in your heart of hearts that somehow, some way, you're going to win against this intruder that suddenly turned your lives upside down. And you don't plan to sit on the sidelines either. You're not going to be the other half that sits, or I should say, paces in the hallway, like countless thousands do, while the system sweeps her up in the treatment process. Because you're going to know what to do and how to be there for her. But where? Where do you go to get such advice? Advice you can trust with your life, her life. There's a few options. You could comb professional directories, compare recommendations, seek out the best specialists, and then wait for an appointment. So you can then figure out the best options, in her case, for surgery, follow-up treatment, and then, if reconstruction is to be considered, the best method. Better still, it would be really helpful, wouldn't it, to know the best questions to ask them in the first place, and what considerations to weigh before even stepping foot inside a doctor's office. Then again, you could also get grassroots about it. Check out support groups until you can find one that feels like a fit. But that's time-consuming too. You need a group where you can find other women of approximately the same age, the same type of breast cancer and stage of disease, so you can get more relevant feedback to your questions. Although, do be prepared for the fact that she just might not be emotionally ready for this right now. And I mean the fear of seeing herself in these women down the road. But rest assured, your be prepared thinking is on track. But timing is key here. Studies have shown that getting the right information as soon after diagnosis as possible makes a huge difference in reducing her anxiety levels and her insomnia. You know, those fitful bouts of sleep that leave her emotionally exhausted and her body weakened, jeopardizing her recovery when she needs it most. The right information at the right time also increases her ability to cope, yours too, and to think more clearly, as well as boosts her confidence to get involved in the very decisions that are affecting her life, so she can choose an optimal treatment for her, according to what's best. And having solid guidance early enhances the intrinsic value of the doctor-patient relationship. In fact, studies show that the amount of valuable information you receive as a patient is a result of that established rapport and comfort level, your ability to show that you want to participate in all of this, be treated as an equal partner in your care. Are those good enough reasons to want to shorten your learning curve and put this diagnosis in its place? Then here's your checklist. Here's what you want. You want organized advice from the best of the best cancer experts so you can feel confident every step of the way, as well as have the kind of expert direction that can also keep her anxiety at bay to make the situation more bearable right now, while you sort your way through this, so you can deal intelligently with what lies ahead and start on the right path together as things unfold. And you also want to make sure that she is armed with a checklist of everything she absolutely must ask, so she doesn't have any regrets about the decision she makes down the road. And you yourself, you want instruction, so you're absolutely clear about your role and the best way to support her. And finally, you want ease of access to an all-in-one solution that meets everything we've talked about. At your fingertips, anytime, anywhere. So you can even carry it around in your pocket on the go, or access it when you want the privacy in your own home. A solution that saves you time, worry and frustration, and even money on unnecessary appointments, because you've been able to eliminate the panic, the confusion, and see past it to the best solution.